If you are confused between PRP, stem cells, and SVF, you are not alone. Most people assume they are all the same. They are not. Clinics market them as miracle cures. Websites contradict each other. And in my previous video, I explained why many of these treatments fail. Not because they don't work, but because they are used in the wrong patient or used incompletely. One doctor says PRP is enough. Another says you need stem cells. A third says everything is experimental. So naturally, you are confused. In this video, I am going to simplify this completely. I'll explain what each treatment actually is, how it works inside your knee, where it works and where it does not. And most importantly, which patient each treatment is actually meant for. I offer all three at my clinic, so I have no reason to push one over the other. Which also means I see where each one fails. My job is simple: the right treatment for the right patient at the right stage. Let's go through this clearly, step by step. I am Dr. A.K. Venkatachalam, founder of the Madras Joint Rejuvenation Centre, Chennai, fellow of the Royal College of Surgeons, trained in the UK with over 2 decades of experience in joint care, from joint replacements to advanced biological treatments. What I am sharing today comes from real patients, real outcomes, and long-term follow-up. What do PRP, SVF, and stem cells have in common? They are all orthobiologics, treatments taken from your own body used to stimulate healing. No implants, no joint replacement, no general anesthesia. You walk in, you walk out. The idea is simple. Instead of replacing the joint, we try to improve the biology of the joint, reduce inflammation, support repair, improve the environment. But how they do this and how powerful they are is very different. Let's start with PRP. Platelet-Rich Plasma. Most commonly done, most misunderstood. We take your blood, spin it, concentrate platelets. Platelets release growth factors, signals that tell your body repair, reduce inflammation, heal. We inject it into the knee precisely under ultrasound guidance. Who is this good for? Early stage problems. Grade 1, early grade 2, pain on stairs, after sitting, morning stiffness. PRP works well here. But here's the limitation. PRP gives signals but no cells. It tells the body to repair but does not provide the machinery. So in more advanced disease, PRP alone is often not enough. And when it fails, it's usually not because PRP is bad. It was used in the wrong patient. And this is exactly what I explained earlier. Treatment failure is rarely about the injection. It's about selection and what's missing. Now, stem cells. This term is used very loosely. In orthopedics, we use adult stem cells from your own body, bone marrow or fat. These cells can reduce inflammation, support repair, regulate the joint environment. But here's the key. Their signaling role is just as important as the cells themselves. So when someone says stem cell treatment, you should ask, where are those cells coming from? Traditionally, bone marrow. But many of us have moved towards fat, because fat is not just storage, it is biologically active tissue. It contains more regenerative cells, more supportive cells, a better healing environment. In older patients, bone marrow quality declines. Fat is more consistent, easier to harvest, local anesthesia, better tolerated. The cell-rich fraction from fat is called SVF. SVF is not just stem cells. It is a biological ecosystem. Stem cells, support cells, immune modulating cells working together. We harvest fat, process it, inject it into the knee. Who is this for? Mild to moderate arthritis, grade 2. early grade 3, where PRP is not enough, but the joint is still salvageable. SVF provides actual repair cells and a stronger biological effect. PRS PRASAD. At our center, we don't look at these treatments in isolation because PRP alone or cells alone is often incomplete. This is exactly why we developed the PRASAD treatment. PRS, Platelet-Rich Stroma, combines PRP and SVF. Now you have cells, signals, and a scaffold. Think of it this way: SVF provides the workers, PRP provides the instructions. Together they work more effectively. This is the most complete biological treatment we offer. But this is critical only in the right patient. If the joint is bone on bone, this will not work. Let's simplify. PRP, early stage inflammation, no cells. SVF, cell based, stronger, moderate disease. PRS, PRASAD, combined, most comprehensive, selected cases. And grade 4, these are not the right treatments. Let me be very clear. When these treatments fail, it is usually not the treatment. It is wrong patient selection, advanced disease, or poor joint environment. The problem is not the procedure, it is the judgment. One final point: the joint environment matters. If your body is inflamed, high blood sugar, metabolic issues, vitamin deficiencies, even the best treatment will underperform. This is why patients say, "I took the injection, nothing changed." At our center, we treat the soil before the seed. If you are trying to choose between these treatments, the answer is not online. It depends on your stage, your biology, and your joint. That requires proper evaluation. If you haven't seen my previous video on why these treatments fail, I strongly recommend watching that first. If you want clarity, come and speak to us. If you want a clear answer for your knee, the consultation link is below. And if this video helped you, subscribe, share it. Tell me in the comments which treatment were you considering and why. I read every comment. I'll see you in the next video.